Brain cancer is a serious and potentially life-threatening condition that occurs when abnormal cells grow uncontrollably within the brain or in structures surrounding the brain. These abnormal cells form a mass known as a tumor, which can interfere with vital brain functions such as thinking, memory, movement, speech, emotions, and regulation of breathing and heart rate. Because the brain is the central control system of the human body, even a small tumor can cause significant neurological problems. The brain is responsible for controlling all voluntary and involuntary functions of the body. It consists of three major parts. Cerebrum, responsible for higher cognitive functions, such as thinking, decision-making, memory, speech, and voluntary movement. Cerebellum, controls balance, coordination, and fine motor skills. Brainstem, regulates essential life functions, including breathing, heart rate, blood pressure, and consciousness. Due to these critical roles, any abnormal growth within or near these structures can result in serious clinical consequences. Brain cancer refers to both malignant, cancerous, and benign, non-cancerous tumors that arise in the brain or its surrounding tissues. Although benign tumors do not spread to other parts of the body, they can still be dangerous because they may compress brain tissue and disrupt normal brain function. Malignant tumors, on the other hand, tend to grow rapidly, invade surrounding tissue, and are more difficult to treat. Brain tumors are broadly classified into two main categories: primary brain tumors and secondary metastatic brain tumors. Primary brain tumors originate directly from cells within the brain or its protective coverings. Common types include gliomas, tumors arising from glial cells which support and protect nerve cells. Astrocytomas, a subtype of glioma arising from astrocytes. Gliomablastoma, the most aggressive and malignant form of primary brain tumor, characterized by rapid growth and poor prognosis. Meningiomas, tumors that develop from the meninges, the protective membranes covering the brain and spinal cord. Medulloblastomas, tumors most commonly seen in children, typically arising in the cerebellum. Secondary metastatic brain tumors occur when cancer cells spread to the brain from other parts of the body, such as the lungs, breasts, liver, kidneys, or skin, melanoma. Metastatic brain tumors are more common than primary brain tumors and often indicate advanced systemic cancer. The exact cause of brain cancer is not fully understood. However, several factors are known to increase the risk, including exposure to high levels of ionizing radiation, especially during childhood, genetic disorders and inherited syndromes, a family history of brain tumors, increasing age, occupational exposure to certain chemicals. It is important to note that lifestyle factors such as mobile phone use have not been conclusively proven to cause brain cancer. Symptoms of brain cancer vary depending on the tumor's size, location, and rate of growth. Common symptoms include persistent or worsening headaches, nausea and vomiting, particularly in the morning, seizures, especially in individuals with no prior history, weakness or numbness in the arms or legs, difficulty with speech, vision, or hearing, balance and coordination problems, changes in personality, behavior, or mood, memory loss, and impaired cognitive function. These symptoms often progress gradually but may worsen rapidly in aggressive tumors. Diagnosis of brain cancer requires thorough neurological evaluation and advanced imaging studies. Common diagnostic methods include magnetic resonance imaging, MRI, which provides detailed images of brain structures, computed tomography scans, CT scans, particularly useful in emergency situations, neurological examinations to assess brain and nerve function, biopsy, where a small tissue sample is obtained to determine the exact tumor type and grade, additional laboratory tests when indicated. Accurate diagnosis is essential for determining the most appropriate treatment plan. Treatment depends on the type of tumor, its size and location, the patient's age, and overall health status. Management often involves a combination of therapies. Surgery, the primary goal of surgery is to remove as much of the tumor as safely possible while preserving neurological function. Complete removal may not always be feasible due to the tumor's location. Radiation therapy, high-energy radiation is used to destroy cancer cells or slow their growth. Radiation therapy may be used alone or in combination with surgery and chemotherapy. Chemotherapy involves the use of drugs to kill cancer cells or inhibit their division. These drugs may be administered orally, intravenously, or directly into the cerebrospinal fluid. Targeted and immunotherapy, modern treatments include targeted therapies that focus on specific molecular abnormalities in tumor cells, as well as immunotherapy, which helps the body's immune system recognize and attack cancer cells. Both the disease and its treatments may result in side effects such as fatigue, hair loss, nausea, cognitive difficulties, memory problems, emotional changes, and increased risk of infections. The severity of these effects vary among individuals. Patients with brain cancer require long-term medical follow-up and comprehensive care. Psychological support, physical rehabilitation, appropriate nutrition, and social support play vital roles in improving quality of life. Family involvement is essential in the overall care process. There is no guaranteed method to prevent brain cancer. However, minimizing unnecessary radiation exposure, maintaining a healthy lifestyle, and seeking medical evaluation for persistent neurological symptoms may help reduce risk and enable earlier diagnosis. Brain cancer is a complex and serious medical condition that requires early diagnosis, specialized treatment, and multidisciplinary care.
Although it remains a challenging disease, advances in medical technology and research continue to improve treatment options and provide hope for patients and their families.